I did my research assignment on what is meant by flattening the curve, a term that we have been hearing a lot of in this pandemic. So what exactly is meant by flattening the curve? It's a term we've probably heard a lot, and it is important that we are informed of it. When you hear the term flattening the curve, it is likely that you see it paired up with an image like the one on my slide here. The curve represents the number of people infected. The more people infected, the higher the curve will go, and the less people infected, the smaller the curve will be. Through the graph is a line that shows how many sick people hospitals can treat. The tall curve goes above the line. That means too many people are sick at one time and that we won't have enough hospital space or resources for all the people who will need treatment. The flatter curve shows what happens if the spread of the virus slows down. The same number of people may get sick, but the infections happen over a longer span of time, so hospitals can treat everyone. These are the two possibilities for a pandemic like this, one being a fast pandemic, and the other being a slow pandemic. In a fast pandemic, many people get sick at the same time, and hospitals become unable to handle it. There is not enough equipment to go around, and people will die untreated. This image shows the capacity of the healthcare system and how if too many people become infected, how it can easily be overwhelmed. More healthcare workers get sick themselves, and as a result, the quality of the healthcare system gets worse. The number of deaths will rise significantly. There will not be enough resources to go around, and decisions will have to be made about who gets help and who doesn't. The image here demonstrates how a fast pandemic will look. Lots of people will be left untreated, and due to the healthcare system being overwhelmed, only some will be treated. To avoid this, we need to flatten the curve by practicing social distancing and good hygiene. This will result in a slow pandemic. A pandemic is slowed down by the right responses. It is the target for so many experts when they discuss the coronavirus because it results in the least number of infections and deaths, does not overwhelm the healthcare system, and allows us to treat the infected. In a slow pandemic, everyone who gets sick can get treatment, and there is no crunch point with overwhelmed hospitals, just like this image on the slide represents. This image here is what the curve will look like if social distancing is followed. Countries coming close to flattening the curve. Many countries are coming close to flattening the curve. One very notable country in this area is South Korea. After they reported their first case, numbers remained low, but then began climbing rapidly, reaching thousands of new cases a day. Then, after a few weeks, infections were being counted in the dozens and even single digits. South Korea did this with 3 guiding principles, these being test, trace, and contain. South Korea developed an extremely effective testing system where people could come to drive-through and walk-in testing centers, stay there for around 10 minutes while they get tested, go home, and then have their results delivered within 24 hours. When people tested positive, they shared their GPS movements so that appropriate alerts could be issued about where infected people had been. Now many countries look to South Korea to see if they can assume similar policies as them. Countries like New Zealand and Iceland have done a good job at flattening the curve as well. Here are some of the sources I used for this presentation. Thank you.